morning and welcome to yet another episode of the Health and Wellness Show. My name is Chabet Birir. Na kama kawaida, this is where we inform you, we empower you and inspire you to take full control of your health and live your best life. Now today we are talking about allergies. I'm sure if you are not allergic to something, you know someone who is allergic to either food or dust or pollen or even skin allergies. So today we want to understand how these allergies come about and how you can manage them. And on set with me today I have Dr. Evelyn Nganga, who is an allergist. Karibu sana, Daktari.
Thank you so
much.
And
she will help us understand allergies and how to manage them. And I want us to just dive right in to what exactly are allergies and how do they come about.
Okay, so first and foremost, just to say thank you for this opportunity. I'm very thrilled.
Yeah.
So when we use the term allergies, it means an abnormal immune response to an otherwise harmless substance. Mm-hmm. That is just basically the simple meaning of it. So your body picks on things externally, reacts in an abnormal way, mm-hmm. and then this manifests in various systems. So as you had mentioned, it could manifest on your skin, eyes, nose, your chest, and even your gastrointestinal system. Mm-hmm. And then we also have, various allergies, and I'm sure we can talk a little more.
Yeah. And how different are allergies from other, conditions like intolerance, like lactose intolerance? Is that an allergy?
That's a very common question that I get. So the term allergy, what I would want to just underscore there is that it is an immune system-driven issue or inflammatory process, whereas an intolerance is more of your body not managing a particular food, in this case, as you mentioned, lactose. But in smaller quantities, it has enough enzymes to process the lactose. But when you go beyond a certain amount, then your body is not able to cope. And so we call it intolerance. So you can have lactose intolerance, you can have glucose intolerance, you can even have something we call histamine intolerance, which I'm seeing more and more commonly, whereby foods that are rich in histamine, so for instance, things like strawberries or fermented products, some people may take it and it manifests on their skin or even in their chest.
Okay.
Yeah.
And let me take you back. What inspired you to be an allergist? What made you want to do this?
Okay.
Yeah.
If I look back, it's more because as a pediatrician, because that's my background, I was seeing a lot of children who were coming into the outpatient department with allergies and were having challenges managing these children because there were no specialists in the country. And so I started looking into how do we actually get this information to our people here in Kenya. Yeah, and that's how I ended up going for my allergy training. But over and above that, I also suffer from an allergy. And when I talked to my mom about that allergy, it took many weeks for me to be diagnosed with the allergy that I had when I was much younger. So you can see it's something that dates back. And coming to now the 21st century, surely we should be able to manage these children.
These children, for sure.
Yes.
Now, many people would ignore allergies. Useme mtoto anakohoa, useme tu ni homa. I want us to start with now respiratory. I know we have respiratory, we have skin, we have gastrointestinal.
Yes.
But let's start with respiratory. How do you identify signs and symptoms, and how do you define that this is an allergy and not a cold or a flu? For example, asthma. How do you go about the diagnosis?
Okay. So respiratory symptoms, especially in children, can be very overlapping with other conditions, right? And so you'll find if a child has come in with a cold, for instance, the cold should last for about 5 days. And they automatically outgrow or get over that, the body is able to manage that particular viral infection and they're able to be fine. Okay. When it comes to allergies, in fact, one of the common things that a mom or dad will talk about is homa haishi, a cold that is never ending. So you'll find for infections, they have a timeline, often anything between 5 to 10 days. But for allergies, they'll tend to be very prolonged. Symptoms keep persisting, and symptoms may also appear in certain environments or, change of weather, so seasonality. When it comes to asthma, one of the commonest things that makes us have like a red flag is a child who's having a dry cough in the night that doesn't seem to go away. This may or may not be associated with wheezing, which is like a musical note that comes from the chest and more so heard when they're exhaling or when they're breathing out. This is a child when they play too much or if they laugh too much, they start coughing. So exercise-induced symptoms are the things we talk about. Or they feel a sense of tightness in the chest or a sense of they're not able to breathe properly. So they feel like they're short of air. So they're struggling to pull in this air because their airways are constricted. So they struggle. It's almost like pulling in through a straw. It's very hard. So these are some of the common symptoms when it comes to asthma. And then over and above that, there may be a history in the family of someone else who is either asthmatic or have another allergic condition.
Okay.
Yeah.
So prolonged coughing, wheezing, are some of the signs and symptoms of asthma.
Correct.
And how do you manage asthma, for example?
So for asthmatic patients, we are trying to help them get relief of the symptoms. And we work a lot with pulmonologists or even just fellow pediatricians who have identified these children who have asthma. So one of the reasons we receive patients into our allergy clinic who have asthma is over and above trying to give them relief through inhalers. And for the inhalers, we'll go a little bit later into it.
Yes.
We also want to try and identify if there are things in the environment that are triggering this asthma reaction. So not all asthma is allergic, but a good proportion of children with asthma will have, it will be the allergic kind of asthma, if I'll call it that.
Okay.
So as an allergist, we go down and try and assess, is there something in the environment that's driving an inflammation in the chest, that's causing the airway to constrict? And once you identify that, in addition to the inhalers, as I mentioned, then you give this child significant relief.
Okay. And how do the inhalers work? And is it only the inhaler that will help manage the condition, or do we have other medications?
Okay.
Yeah.
So inhalers are generally of two types. So there are those we call relievers, which is a common one is Ventolin. We call it the blue inhaler. So this gets into the system and works very quickly. Within a span of 30 minutes, it's caused relief. So it basically causes relaxation of the smooth muscles in the lung system, along the different pipes that are found in the lungs.
Okay.
So a lung that is this tight opens up nicely after giving the Ventolin. But remember, it gets in quickly and gets out just as fast. Then there's what we call the control therapy. So these are inhalers that help to control or keep the inflammation down. So it's not a quick in and out kind of thing. It stays in the system for some hours and keeps the inflammation down and the lungs quiet. So over and above this, there are many other medications that are available. So you'll find there's some combined inhalers. So they combine the characteristics of both the reliever and the controller in one. Those combined ones are very good for people like teenagers who don't want to be carrying around so many medications. They're involved in sports. They want something quick that they can use. So you have the combined inhalers. You also have some tablets that we give children. They work in a different manner to the inhalers, but help especially the allergic kind of asthma that is associated with also the nasal inflammation.
Okay.
So there are certain tablets that we give towards that.
Okay.
And then for other advanced places or countries, they also use biologics. So biologics block a different pathway of the inflammatory system.
What are biologics exactly?
So biologics, these are compounds that are used to try and arrest the inflammation. So for us, the drugs we use arrest the inflammation when the inflammation is already happening quite a bit.
Okay.
Biologics arrest it a bit earlier. So it gives quicker response, quicker relief. Yes, but they're also very expensive, and it takes quite a bit of time to get them into a country, to get them approved and all those things.
Okay. I'm still curious on these biologics. What do they entail? Is it natural stuff or just manufactured drugs?
So it's not natural. It tends to be manufactured compounds.
Okay.
And how they are given is through injection. So they're actually injectable things that are given onto the skin. And then you have them either weekly or every 2 weeks. And you find that over a period of, say, about 30 weeks or so, there's significant improvement.
Okay.
It's not for use for everyone and anyone. It tends to be used more for the very severe asthmatics or those who are not responding to
the normal
treatments.
Okay.
Yeah.
Now, we've talked about asthma. And you've also mentioned that before you diagnose, you check that what are the causative factors of asthma or the allergy. Like dust, is it a cause for asthma, pollen, or do we have other respiratory allergies apart from asthma?
Okay, so when it comes to asthma, environmentally, the common things that we see that affect children or even adults for that matter is dust mites. So dust mites are tiny microscopic creatures that you cannot see that excrete up to 20 times in a day. And they thrive in certain areas like mattresses and pillows, blankets, so anything that's fluffy. For young children who love their teddy bears, they're in their millions as well on these fluffy toys. And that's what people tend to react to. So they tend to react to the excreta or the excretions from these dust mites. And they're called dust mites because they live in dusty areas or environments.
Yes.
So when you say someone is allergic to dust, a lot of the time it's actually the dust mites that are in the dust that they're allergic to. Over and above that, there's different types of pollen. So like we've just come from a jacaranda season. So there's a tree pollen. There's grass pollen. After a rainy season, grass grows its cut. Children are playing in the field. The pollen is suspended in the air. And children who are allergic will inhale this pollen and it will cause the constriction. That is the asthma.
Okay.
Cockroaches also are a very common trigger. And
How
the more
so?
we do tests, the more we are realizing a lot of people are actually allergic to cockroaches. Yes.
Wow.
Because again, cockroaches tend to go around excreting various material that gets what we call aerosolized or, suspended in the air. So when you're in an environment that is infested, then there's some children, when they inhale that, it causes inflammation in their lungs, tightening of the chest, and the symptoms appear. Over and above that, we also have mold, which is also a very, very big trigger. So it's always good to assess your houses, make sure they have good aeration, good sunlight coming in. If there are any damp areas, get that addressed. Because again, if you inhale the mold, it may trigger your child or you as a person.
Yes, and also in the cold season, you'll find that when clothes are not drying outside, people hang them inside.
Exactly.
In the bedroom mostly.
Exactly.
So what would you advise them?
Do not do that.
Do not do that.
Nguo zibaki nje. Or if your home allows you to hang them somewhere on a veranda or corridor, that's better than having them inside your house.
Okay.
Because of course that water that's evaporating is getting
lungs.
into the house and keeping it damp and then creating an environment for mold to grow.
Okay.
Another way of getting mold, by the way, is not just damp areas. It can grow even in, like when you have raked some leaves to a corner and they're decomposing. So any areas of decomposition, you may also have mold.
Interesting. I'm learning as well.
Yeah.
All right. So now let's talk about allergies of the skin. I know one common one, that's latex, and specifically condoms, where people say, I'm allergic to condoms. So is that a thing? And what other allergies of the skin do we have?
Yeah. So latex allergies is definitely one that we see. Not as common though. And anything that is made of latex. So for instance, if you think of children, apart from the condoms that you've mentioned, which is a problem.
It's a problem.
Can also be balloons. So the balloons that children blow. For healthcare professionals like myself, the gloves. So you'll notice a lot of the time nowadays in the market, you have latex-free gloves, just to be able to reduce that reaction. And of importance is that latex, it comes from a rubber tree. And the structure of that latex is sometimes similar to other foods that people may consume. So as a person with latex allergy, you may actually react to certain foods. And commonly that would be things like kiwis and bananas. Okay. So the same reactions you may have with the latex, or even different, you may eat a banana and start to feel itchy in your nose or in your throat, in your mouth with a bit of swelling. We call that the latex food syndrome.
The latex food syndrome.
Yeah.
So how do you manage it? Do you avoid latex entirely? Or is there another way that you can manage such allergies?
The interesting thing with allergies is once you identify the trigger, just avoid
you
it.
Avoid it.
It's as simple as that.
Okay.
But no, it becomes very tricky if this is a person who's going into theatre, because even in theatre you may find a lot of the piping and just different equipment that is used may contain latex. So it's something that must be announced prior to the surgery so that they can make the necessary changes that need to be done. You mentioned other skin allergies, so apart from the latex, so the commonest that we see is eczema. Or something we call atopic dermatitis. Tends to happen quite early in childhood and tends to appear on the cheeks. So you have like dryness over the cheeks with a bit of a red rash. Sometimes it may be weeping. Weeping meaning it's producing some fluid because you're literally losing water out of this baby's skin. It tends to be very itchy. And over time, the areas in which it manifests varies. So in between the joints, both around the elbows, behind the knees. For older children, it may appear more on the torso or on the back, on what we call the extensor surfaces.
Okay.
It can be very stressful, problematic, yes, and stressful to the families.
Yeah, I know eczema. A lot of that one is common. Because even my own 8-year-old started manifesting those symptoms, but I see now it is going. So I'm keen to know what really causes eczema and other skin. But let's focus on eczema first. What causes it and how do you manage it?
Okay.
Yeah.
So eczema, as with any other allergy, can be multifactorial. Like it tends to be very complex. One of the commonest things is you may have a genetic predisposition. So in your family, there's someone who has eczema. And for those who tend to have the very severe eczema, it could be an issue of your skin barrier. Like you literally have a defect that makes your skin not have a proper barrier that is genetically passed down.
Okay.
Okay. So
is it entirely genetic or
not entirely?
Okay.
So like the ones who have very severe eczema, a lot have been found to have that genetic defect. Okay. Then secondly would be things in your environment that may also be driving this eczema. Something we really don't think about is what we put on our baby's skins, the detergents that we use to wash our baby's clothes, the things in the environment like pets or the dust mites that I just talked about. So there could be other external influences. But over and above that, do not keep your child's skin dry. It needs to be moisturized because the more dry the skin, the more it cracks and the more external things get in there and cause the inflammation. Yeah.
You've mentioned about moisturizing, but what about hydrating? Is it helpful when you drink a lot of water? Yeah,
hydration, as with other organs in the body, and the skin being the largest of them, it's a great beneficiary of water drinking. Not to say that it's a solution per se, but of course it definitely helps.
Okay.
Yeah.
Now, treatment options for eczema. For me, for example, we went to hospital several times. We were given different creams. We were told not to use perfumed soap. But, with time, it just ilisha.
Okay.
But how do you manage? Because I know it is very problematic for many parents who may avoid all those things, but still the eczema isn't going away.
Right.
Does it ever go away for, people?
Yeah. So I will say it also depends on how severe the eczema is. Okay. So the treatment ranges from, for the very mild eczema, they'll respond very well to just extensive moisturizing. And by moisturizing, we don't mean like once a day. It needs to be at least 2-3 times a day if you know your child is prone to dry skin. Use of hypoallergenic detergents, hypoallergenic soaps, as you have clearly stated.
Yes.
And a lot of these children tend to outgrow their eczema. Anytime between 5 to 10 years, you'll find the eczema starts to calm down and disappear. For those who have the more severe eczema, we need to sometimes incorporate other treatment modalities. So one of them is steroids, so steroid creams. And what I'll say about steroid creams, they are of benefit, but they must be used very judiciously over a short period of time. So we normally give them for at least 5 to 7 days maximum, and not all the time. A lot of times, some people will mix the steroid creams with their moisturizer and end up applying it over extensive like over the
whole
whole body, whereas
yes.
it's not the whole body that may necessarily need the steroid. So for us as allergists, we tend to prefer to use the steroid cream on the affected areas first, allow for 5-10 minutes, and then apply the moisturizer over the rest of the body.
Yes.
Over and above that is something we call wet trap therapy, which is very interesting. Most parents, when they hear about it, look at me like you must be out of your mind, because it entails putting like 2 layers of clothing on this child. So cotton preferably. We dip the first layer in warm water, wring it dry, and then apply over the area that's affected. So if it's maybe the whole torso, so the front and back, they can wear a t-shirt that's been dipped in warm water, wrung dry. They've done their moisturizers. They wear that on the inside, then they put a warm layer on top. So it keeps the skin very cool, reduces the itchiness that especially happens at night, and you'll notice that the child will have one of their best sleeps that day. So that's also another way of treating. Then over and above that is the biologics that I mentioned. So there's biologics for respiratory allergies, but there are also biologics for eczema, for skin allergies if it's really bad.
I like that you've mentioned something about the steroids. And not using them for a long time.
Yes.
It's a very common issue where, the parents don't even go for to the doctor for prescriptions. They do over the counter. And I know even because I've used them before, they have a disclaimer that you should not use for more than 7 days because they could cause organ damage.
Correct.
Would you please elaborate on that so that people can understand it better?
Yes. So steroids are anti-inflammatory agents, and they help very well, in certain for certain diagnosed issues. A lot of times people misuse the steroids because they work, and they tend to work quite fast. Some may even go to the extent of taking them orally. So when it comes to skin, the good thing with the skin, you can control the amount that goes onto the skin. And by the way, it's not just a squeezing the tube, rubbing and applying. There's something we call the fingertip unit technique that is helpful for you to know how much steroid actually goes onto the skin of this child. And remember also, steroids are of different potency. So it means there are mild steroids and there are those that are highly potent, which means they have a higher risk of causing damage, especially if they're used for long. So when you're continuously applying these steroids onto your skin, remember they're being absorbed into the skin.
Yes.
And so the longer you use it, the more they're absorbed into the skin, and the more they can go and affect what we call the adrenal glands. So these are little glands that sit on the kidneys. And that's where a lot of hormones may be produced. So you may find that it causes a bit of disruption there. Over and above that, it can affect the skin, so making the skin thinner. Then when you go out to the sun, you feel like you're burning. It can make you get what we call striae. And because of that hormonal imbalance that I mentioned about the adrenal glands, the child may start getting like a puffy face, or what we call a moon face. It can start affecting your kidneys. So the shorter you use it, the better. But for prolonged use, it has to be under guidance, and there's never a time we have to use it for that long anyway. And plus, if it's a child who we feel needs a more prolonged treatment approach, there are other options that are free of steroids that we can then incorporate.
All right. We're about to take a break, but one last question before we do that. There's a concern also still on those steroids, apart from the organ damage and, like you said, the moon face, the shrinking of skin when you use it over time. How does that come about?
I don't understand that question though. What do you mean by shrinking of skin?
Like when you apply the steroids on your skin for a longer time, they tend to, crease, like you look older than normal.
Yes,
you really are.
Exactly. I think that is now speaking to the thinning.
Oh, that's the thinning
so
of the
your
skin now.
thins, your collagen becomes much less. The skin looks wrinkly, as you're mentioning. It's very easily abrased. Like some people, you can even just do this and literally break the skin because of how thin it has become. Some children may even look like they have been bleached. So they also lose a bit of their melanin. So these are some of the effects that we see with prolonged use of steroid creams.
All right. Thank you so much for such an informative discussion, Daktari. We are taking a short break, and when we come back, we'll talk about food allergies, of course, together with the myths and misconceptions around allergies. Don't go away. Welcome back. If you've just tuned in, this is the Health and Wellness Show. My name is Chabet Birir, and today we are talking about allergies. With me on set, I have Dr. Evelyn Nganga, who is an allergist and also a pediatrician. So she understands how allergies come about, how to treat them and manage them, you know, over your lifetime. Karibuni sana to the show, and karibu pia Daktari.
Thank you.
Before we went on a break, we were talking about the steroids and how they affect your skin.
Right.
And it's a burning issue because someone has asked a question still on the same in terms of skin bleaching. I know you're not a dermatologist. Correct. But would you know if these steroids are safe for skin, or, you know, skin bleaching? You know, there are people who are using it for other things like skin bleaching.
Right.
But also, the main issue is how safe are they? Because when you apply them over time, you see that your skin starts to change its color and tone. Right. So what would be your advice on that?
Okay, so first and foremost, I don't intend to see any children who are doing any skin bleaching for any reason. So
mostly now this is for adults.
So for the adults, honestly, don't use a steroid for skin bleaching because that is not what the steroid has been, you know, made for or manufactured for. It just happens to be one of the side effects because it interferes with melanin production on the skin. Remember, for you to even attain that skin bleaching, you need to have used it for a prolonged period of time. And so, in addition to having this thin skin, in addition to having a disruption of your adrenal glands, you may end up causing more problems in your body, including infertility, because you're disrupting your hormones, right? You're putting yourself at risk of skin cancers because you're making your skin so thin, you're reducing the melanin production. We who are dark-skinned are actually at a better advantage when it comes to UV light absorption. Melanin helps us do that. So when you reduce that, then you're also putting yourself at risk of other things. So do you want light skin and have cancer along with it? Light skin with infertility? So there are many other disruptions that come with it. So the answer is no. It is not safe.
Avoid steroids for a longer time. If it's prescribed, use it for the time that it's been prescribed so you can be safe.
Correct.
All right, now let's move to food allergies. People are allergic to things like meat, eggs, cow's milk, which you said is lactose intolerance.
Right.
All right, let's now talk about food allergies. We have people who are allergic to milk, meat, eggs, and even nuts.
Right.
And this one for nuts, I've seen it in movies where someone takes peanuts and they get red for the Caucasians. How do this come about, and how do they affect your your intestines and your digestive system?
Okay. So food allergies are a big one, and it's one of the commonest things. I think after eczema, it's the next commonest thing that we deal with. And I'll just start off with how they even come about, or what are some of the predisposing factors. One interesting thing is, for the children who have eczema, when they're very young, if you do not handle that eczema in time, you can actually put that child at risk of food allergies.
How does that happen?
That's a good question. So, because your skin is to protect you from things that are external. Once you disrupt that barrier, then things that are external will happily go in through the skin. So I'll give an example, and this was actually an actual example. A mother who had a baby, the baby was probably less than 6 months old, had quite some extensive eczema. And when the mother was cooking fish, because she cooks it anyway, regularly, on one of the occasions, she noticed that the child was reacting This is a child who's not eating the fish. She's on her back. She's busy cooking in the kitchen.
But she's reacting.
Then I think she just realized that the baby is either itching, scratching, and they're having an actual reaction. So how this happens is, I'll give the fish as an example. So you're cooking the fish, it's getting aerosolized in the air. The fish proteins are landing on that baby's broken skin. So instead of the immune system seeing this food through the mouth, which is what is supposed to happen, the immune system is seeing it through the skin. And because it's on guard, it processes that protein of fish as a foreign body or a foreign substance, produces antibodies against that particular food. And the day you start weaning this child and by mistake you give them the fish, they react. And you wonder, but how? You know, I've never given this child fish. So there's a link between eczema and acquisition of food allergy. So that's why we are always very strict on eczema management, so that you reduce the chances of a child getting food allergy.
Food allergies.
So one of the ways now with that of preventing food allergies is also at the point of weaning, between the period of 6 months to 11 to 12 months.
Okay.
The body literally gives you a window to explore different foods. So we always say, give your baby as many of the highly allergenic foods as possible, as quickly as possible, within that time period that the body has given you. In the event that doesn't happen, then your baby may react to some of these foods. So one of the commonest ones we see in this country, I'll say, is milk and eggs. So at the point of weaning, the baby was exclusively breastfeeding, then you start giving formula milk. And one of the commonest ways of knowing a child is allergic to a food is either they refuse it completely, they do not want to have that food at all, or as soon as you give it, they vomit it out.
Or they vomit.
So one of the commonest things that happen. That's one. Two, they may take it, even if they're taking it because they're being forced to eat it, and they're just moving side to side with the parent. Eventually they consume it, and then within a span of 30 minutes, 30 to 2 hours, you notice your child either has turned red, as you mentioned, they're broken out into hives, what we call the big bumps on the skin that are very itchy, or they may start having diarrhea, they may start having a nasal congestion that they didn't have, suddenly this child has a cold. Where does that come from? Watery eyes, swellings, they can even have an eye swelling, ear swelling. So these foods, that should give you should raise an alarm. Is this child actually reacting to milk? Another common way they react is to Cerelac. Our kids, they love being given Cerelac. So you'll find out each time you're giving this baby Cerelac, they're reacting. Because the Cerelac also contains cow's milk in it.
All right.
Yeah.
Now, there's something called hygiene hypothesis. I don't know if that's why you're saying that kids should be given all different foods before they pass the 1 year mark. And how does it work? The belief that, the more you get exposed, like even with respiratory allergies, the more you get exposed to, say, cold or dust, the more immune you become. Is it true? Or even with eggs and meat, watu wanasema dawa ya moto ni moto. Mtoto akiwa allergic kwa mayai, mpatie mayai zaidi ndio your allergy ishe. Is that true?
Okay. So maybe we can start with the hygiene hypothesis. So this is a hypothesis that posits that the cleaner you are and your environment and your child's environment, then the higher the risk of you actually acquiring an allergy.
Yes.
And the reason behind this is a baby has it's like a clean slate of the immune system. It needs to be trained. This is an immune system that needs to know what is good for me, what is not good for me, what should I form antibodies to, what should I tolerate. So the earlier this child is exposed to dirt, then the body is quickly able to be trained that this is dirt, this is found in my environment, and I am okay with this because it's in my environment. That's one way. Secondly, as they're being exposed also, they're getting infections. Each time your body gets an infection, it literally acquires new information. It's like, okay, that was a virus. We've never seen this virus before. We're going to form antibodies to it. Anytime it comes again, we attack. So you're
like
training.
An natural vaccine of sorts.
Exactly. Okay. So you're literally training your body on how to respond to its environment. Once you take that away from a child, then now the body is like, okay, this food this child has eaten we don't know what this is. Is this good? Is this bad? Should we be attacking this? Should we not? So you fail on that very important training of the immune system.
Okay.
So basically the hygiene hypothesis is just to say, over time we've become too clean. And so that may be one of the reasons even allergies are rising, in the last couple of decades, just because our bodies are not being trained early enough to fight and to accept
new foods and environmental factors,
and to know the difference.
Yeah. Okay.
Yeah. So also, if you introduce the food during that window I was talking about, through the gut, because through the gut knows whatever is coming in through the body knows whatever is coming in through the gut should be safe for me. So then it keeps it aside as this is food, we don't attack. This is infection, we attack. So once you miss that, then you dysregulate the immune system.
Okay. Yeah. And there's also, when a kid gets sick, you take them to hospital, they prescribe drugs like antibiotics.
Right.
Does the increased use of antibiotics also increase the risk of allergies?
Absolutely. And how I'll explain that is, and especially if you're using the antibiotics for viral infections, which it should not be used, right? In our body, we have more bacteria and viruses on our skin and gut than we actually have our cells that make us up, okay? So, and one of the biggest places where you have this, array of bacteria and viruses is our gut, what we call the microbiome. So you find a child who's less than 1 year who keeps being exposed to all these antibiotics. The function of this antibiotic is to kill and destroy bacteria, whether good or bad. So you'll find even as it is attacking the bad bacteria, it's also attacking the naturally existing good bacteria in our gut. So you end up in a state of what we call dysbiosis. So it's basically a disruption of that equilibrium of the gut bacteria, virus, and all these other things. So then you sort of make your body more vulnerable to going into an inflammatory kind of direction, as opposed to being kept in check by the good bacteria and viruses.
Okay.
So we normally say, please don't give antibiotics unnecessarily, because you're going to then predispose this child to unnecessary inflammation in the future.
And we have an increasing number of people actually buying antibiotics over the counter.
Oh, that's not even getting into that one.
Which is wrong.
Yes.
And it's causing a lot of antimicrobial resistance as
Absolutely.
well. So how would you advise, even, parents and adults alike, parents who go over the counter to buy antibiotics for their kids and adults who also go to buy for themselves, does it also cause, the risk for allergies in adults? And how would you advise them?
So in fact, it's a good thing you've mentioned that, especially for the adults, because when you have this dysbiosis happening in your gut, it may also predispose you to other lifestyle diseases, leave alone even the allergies. Because you'll find that things like even diabetes, Alzheimer's, autoimmune conditions are as a result of a dysregulated immune system.
Yes.
And so one of the things that keeps the immune system in check is that gut microbiome, as I mentioned. So the more you do all these antibiotics, the more, in addition to predisposing yourself to allergies, especially if you have it in your genetics, you're also predisposing yourself to other lifestyle conditions, including the diabetes, Alzheimer's, etc.
Okay.
Yeah.
All right. So don't buy antibiotics over the counter, and also watch what you eat and what you surround yourself with in terms of, now avoiding infections so that you don't have to go to hospital. But at the same time, also, like Daktari is saying, it's good to expose your children at a young age. Let your children go and play with mud and dust.
Absolutely, what we did.
It is okay to play outside and interact with all those things, so that then their immunity system gets built up, right?
Exactly.
All right, thank you so much, Daktari. Let's now talk about the myths and misconceptions around allergies. There's one common one, the one that I just said, that when you expose your child to, eggs, for example, if you find that they're allergic, with time they tend to, accept the eggs. Like the body now accepts the eggs or the meat which they were first allergic to. Is that true?
I'll say to some extent it is, but this is where I want to start. When a child is having an allergy to a food, we first need to understand what kind of allergy was it. If they were having a very severe allergy that almost made this child die, the severe allergic reaction that we call anaphylaxis, then no, I will not advise anyone to continue giving that food, because you're literally putting that child's life in danger and at risk. Okay. If it is a mild allergy, they just get a bit of a rash, doesn't seem to be affecting them much, then by all means give small quantities. And in fact, for eggs is an excellent example, because you can give it in baked form, which is more tolerable, like in muffins, advance that to in a pancake, advance that to something like a French toast. And with time, you'll find that this child is able to tolerate. So before anyone makes that decision, it would be important for that child to be assessed first. What is the level of allergy? Are we comfortable with this? In the allergy management, we actually call that immunotherapy. What that parent is doing is literally trying to train the immune system to accept that egg
or that food.
So to some extent it's allowable, but it has to be after guidance and assessment to ensure that your child is not at risk of death.
And I also know another one. People are watching this and just wondering, this individuals are Wazungu, that allergies are a Western problem. Like I said, I first knew about allergies through the movies when someone got a peanut allergy and they reacted to it. So how would you advise parents at home who think allergies are just not our thing?
Yeah. Well, allergies are here with us and they'll continue being here with us for some time. And just because, in as much as it used to be more common in the West, we've also adapted a lot of Western lifestyle, which is where we also find our allergy rates are also going up. Our environment is changing. Lots of climate change, meaning that the pollen season is longer. Some of the pollen that's produced is even more allergenic, as we call it. Our diets are deficient of our fruits and vegetables that we used to eat when we were much younger. So all these things are putting us at risk of having more and more allergies. So what I'll say is, do your part as a parent. Ensure your child is eating a balanced diet. For the young ones, ensure they are breastfed for the first 6 months, because even breastfeeding has been found to be one of the ways that you can actually reduce on the allergy risk of your child. When you wean them with a diverse variety of especially those allergenic foods, and that way you're able to keep the allergies down. Allow them to play outside. So it's not a myth.
It's not a myth.
Or rather, it's a myth. What can I say? The allergies are here with us.
It's a myth to some extent.
Yes, it's a myth.
It depends on your individual allergic reactions, you would say.
Yeah.
All right. And you've mentioned something like, and you've said anaphylaxis is now the extreme reaction to allergies.
Yes.
How serious can it be, so that people can understand that allergies are not just, a minor issue or something that, is not our thing? How serious can it get when you're allergic to something? I'll
give an example, and this was a real life. I actually witnessed it and I was very surprised to see it. I was in a restaurant and someone ate from a buffet that had not been labeled with all the ingredients that were in that particular food. So I was just there watching this man just cough. He was just coughing and he just seemed very unsettled and uncomfortable. He stood up, went to the bathroom. I guess being a doctor, you're always observant.
Yes.
So he came back, he's coughing and he's holding his throat. So it got to a point this man was not being able to breathe. Only to realize that the food he ate contained mushroom, which he's allergic to, had not been labeled.
So unfortunate.
And there was no EpiPen in that environment. An EpiPen is that it's a life-saving device that contains adrenaline, which if you know you're allergic to something, and especially severe allergy, you should always have. So luckily they were able to.
Or how does it work then?
Yes, you just inject yourself, on the upper outer thigh. So we literally, even I was helpless because I didn't have an EpiPen with me. The facility or the restaurant did not have an EpiPen. And so this is someone who could have easily just collapsed and died.
So how did he get help?
An ambulance was called. Yeah, and luckily it came in good time to be able to assist this particular person. So that is how severe
an allergy
can be.
Wow.
And that's one of many stories. Okay, this one I just happened to witness it myself.
You've heard it from Daktari. So allergies can be as serious as life-threatening. So of course this is a call for restaurants and even supermarkets or people who sell things to label foodstuffs and
Very
food,
clearly,
so that if someone is allergic to something, they are aware that I would not take this particular food.
And even schools, I always say for schools, they always have to have an EpiPen.
Yes.
Because that's a child who will collapse there with you and you will not know what to do.
Because you don't even know why they have collapsed in the first place.
Exactly.
Wow.
Yeah.
Okay. Another myth is that, which we've talked about, but it's common. Generally, let's leave the food. You've talked about the food, the eggs and whatnot. But even asthma, skin allergies, that they can be outgrown. Is it, is it written, cast on stone that allergies can be outgrown?
Yes, so the answer is yes. A majority of allergies will be outgrown. If I speak to the food allergies, you'll find like milk and egg allergies a lot of the time are outgrown.
They are outgrown.
The ones that tend to be harder to outgrow are things like your nuts, fish, and shellfish allergies. For asthma, you'll find some patients, especially when they get into like 12 years and above, they get better. However, there are some children who get worse upon getting like in the adolescent period or their puberty period, because their hormones are also a bit haywire during that time. But a good majority will get better, symptoms become less, need for medication goes down as they grow older.
Okay.
Yeah, so the first step is to know your allergy, so that you can know what is the expected outcome of this allergy.
Okay. So they can be outgrown.
It's not a myth.
Okay. Another one is that growing up with pets can help you prevent allergies.
Yes, that's not a myth. It's true.
It's true.
It's very true.
Wow. Okay.
Yeah.
So how does that work?
So it goes down to the microbiome. For you to acquire that nice array of bacteria and viruses, you have to interact with your environment. And what better way to interact with your environment than to have pets for your children?
Said, yes.
So you're petting this cat, you're petting that dog, you're literally exchanging microbiota. And so it goes to strengthening that child's immune system. So if you can't get your child a pet, it also teaches them responsibility. So it's a win-win.
It's a win-win. So get pets. Another one now is that natural remedies can cure allergies. Only natural remedies. Now this is for people who don't go to hospital, they don't consult. Can natural remedies, entirely natural, cure allergies?
I would want to know, first of all, which are the natural remedies that people are using, because the question will be, is it the natural remedy that cured you, or is it just the nature of the allergy and it eventually being outgrown that helped? You know what I mean?
Yes.
So as long as there is no research that's been directly done, this person A is taking this natural remedy, person B is taking the pharmaceutical route, what are the outcomes? It's very difficult to tell whether it is a natural remedy that helped. What I'll say is, though, natural things that occur in our foods and all these things help to stimulate and strengthen our immune system. So in that regard, you may be able to feel better just because you've cleaned out your diet and you're eating better and eating less of high preservative-rich foods, high histamine-rich foods, etc.
Okay.
Yeah.
All right. There's one. Can I be allergic to poverty?
Even my friends joke about that. And we all.
People.
And we all.
People. Problems.
Yeah. I mean, there's certain things that we will be allergic to, and sure, poverty is one of them. But I do not treat that.
You do not treat allergy to poverty.
No, I do not treat allergy to poverty.
But it's good to be allergic to poverty.
It is.
Poverty is not dignity, for sure.
Yeah.
All right. Thank you so much, Daktari, for joining us. It's been a very informative session. Of course, we've learned about allergies that, they can be genetic, that they can come from environmental factors, but it is important to understand your allergy so that you can manage it better. And also, you can outgrow an allergy, so don't give up and don't be discouraged. Thank you so much for tuning in. This is the Health and Wellness Show. My name is Chabet Birir. Have a lovely evening.